Hi there, this is Dr. Whiting, and today I want to talk to you about what I call nutrition mythology. You see, in the field of nutrition, as I suppose in many fields, there are things that start out as rumors, they start out as opinions, they start out as misunderstood information, and if it's repeated long enough and far enough, it becomes fact. And so today I want to take a look at some of those things and just kind of highlight for you how we're misinformed almost on a daily basis. First of all, fats. One of my favorite subjects and one of my pet peeves. There's probably more misinformation rather, about fats than almost any other foods that we would eat. To simplify, whatever fats you've been told are good for you, in general, are not. And whatever fats you've been told are bad for you, in general, are probably good for you. So let's break that down. We have three groups of fats. We have unsaturated, monounsaturated, and saturated. And there's a few in between, but for our purposes, that's it. The unsaturated fats are the worst for you, simply because they form free radicals, they oxidize, they become rancid very quickly, and the free radicals from that oxidation can cause a host of problems from heart disease to liver problems. Then we have another group called trans fats. Trans fats are altered unsaturated fats. We also have what we call solid at room temperature vegetable oils, such as margarines, Crisco cooking oil or cooking fat. These are equally as bad as the classic trans fats. In fact, they should all be grouped under one group, basically. The best fats for you, of course, are either the monounsaturated fats, which include olive oil, avocado oil. Those are the two best ones. And then, of course, saturated fats, which are animal fats, coconut oil, and palm oil. You see, a saturated fat cannot become oxidized because of its molecular structure. Therefore, it's very stable and very safe and will not form free radicals that can damage the internal chemistry and organ systems of your body. So, first myth, whatever you heard about fats is probably not true. Diabetes, as many of you who follow my work know, that we started our research institute back in the early 1990s with our work with type 2 diabetes. Even today, all of these years later, this disorder is still highly misunderstood. Type 2 diabetes is unique in the fact that it causes excess insulin production. This in turn causes elevated blood sugar, it causes insulin resistance, it causes obesity, it causes hypertension, it causes elevated cholesterol because of its effect on the liver, and of course, insulin is a very pro-inflammatory chemical or hormone, and so when your body's producing excess insulin, you have a lot of aches and pains, and you get puffy and swollen because of the inflammatory nature of the hormone. Unlike type 1 diabetes, there's a whole lot you can do naturally to control, prevent, and even reverse type 2 diabetes. Nutrients such as chromium, vanadium, aspartic acid, and other key antioxidants have been proven over and over again to be able to not only control insulin levels, but to improve insulin resistance or sensitivity and to automatically lower blood sugar. So when you hear from your healthcare practitioner, your physician, or your diabetes educator that there's pretty much not a whole lot you can do other than medication and watching the food you eat, and keep in mind the food you eat is very important, but there are a host of nutrients out there that can make the difference between being diabetic and being pre-diabetic. And even if we can't get you away from the pre-diabetes stage, being pre-diabetic is a whole lot better for your body than being full-blown diabetic. Thyroid myths. The thyroid gland regulates a whole host of things, but for our purposes, it regulates metabolism. The majority of people with thyroid issues are what we call borderline. And according to the U.S. Food and Drug Administration, a physician cannot give you thyroid medication or thyroid hormone unless you are over that line. In other words, you have to be bad enough to get help. When your T cells and your other thyroid tests are borderline, the doctor says come back in 6 months or a year, and if it gets worse, I can help you. Until then, there's nothing I can do, which is sad because there's a whole host of things naturally you can do. And if you do them early enough on, it's very possible that you will never have to take thyroid medication, that your thyroid can be boosted, nurtured, and allowed to heal itself. Those nutrients we have combined at our research center into one very unique formula called Thyrox. We have literally hundreds of people using this formula every month with great success, and they are no longer relying on thyroid hormone. Bone loss. Bone loss is a big issue, especially for people past the age of 50, especially for women. Bone loss, or osteoporosis, we are told is a disease or disorder of aging. But why? I mean, I hate to use aging as excuses for anything because most of the time that's simply not the case. When you are losing bone, you are basically, we lose bone every day at all ages. The only difference is that when we're younger, we can replace that lost bone tissue at the same rate in which we lose it. So we have a status quo. As you get older, due to a variety of chemical changes in the body, you are unable to replace the lost bone or lost calcium at the same rate. So you are not in a status quo, you're in a negative. And slowly, after years and years, you lose 2% bone, 3% bone, etc. Well, we know that bone is primarily made up of calcium, some magnesium. So why, if you're taking calcium, would you still experience bone loss? Very simply, because you cannot absorb it. As we get older, certainly past the age of 50, calcium becomes very, very difficult to absorb. So much so, in fact, that we can experience a whole host of calcium deficiencies, from bone loss to leg cramps to night cramps, a whole host of different things. So what we have to do, not only give calcium supplements, we need to make sure the calcium supplement is the proper pH or chemical form in which your body can absorb it. We also need to address your digestive system. If you have indigestion, heartburn, acid reflux, and you're over age 50, your chances of developing osteoporosis and bone loss are 5 to 10 times greater. So we need to fix your digestion at the same time so that you're able to acidify and absorb the calcium at the cellular level. The last thing I want to chat with you about today is cholesterol. Again, those of you who have followed my work know that cholesterol has never been proven to cause heart disease. Never. There is not one clinical study that has ever shown that cholesterol causes heart disease. Now, excess elevated cholesterol, especially the wrong form of cholesterol, what we call the lousy cholesterol or the LDL, if too high, can complicate a pre-existing cardiovascular problem. So for that reason, we need to control the cholesterol. The majority of cholesterol in your body is produced by your liver. It is not coming from diet. Less than 20% of your cholesterol in your body comes from your diet. 80% or more comes from the liver, where it's produced. So if we want to regulate cholesterol, it would seem logical. We don't want to poison the body with statin drugs. We want to nourish the liver rather than poison it. You see, when you take a statin drug, the reason why it lowers your cholesterol is because it damages your liver so it can't produce cholesterol anymore. That, to me, doesn't sound too healthy. How about you? What we do instead is nurture, detoxify, and nourish the liver so that it can regulate cholesterol and other fat production accordingly. and accurately. There is so much that can be done for cholesterol, and when you consider the dangers of statin drugs, there's absolutely no reason why you shouldn't give a natural approach a try first. Statin drugs now have been shown to cause dementia. They have been shown to cause Alzheimer's. They can contribute to bone loss, anxiety, cramping, electrolyte imbalance, brain fog, and the list goes on and on and on. And yet every physician in America wants to pass statin drugs out to their patients like they were candy mints. And that's because they too have been brainwashed to believe that that's the only way to control cholesterol, and B, that cholesterol is the primary cause of heart disease, which it is not. That having been said, we now expose another myth. Cholesterol does not cause heart disease, and cholesterol can be regulated safely and naturally without the use of dangerous and sometimes even deadly statin drugs. If you would like more information about these topics, if you would like to learn a little bit more about the natural approaches, please feel free to contact my research institute. The toll-free number is 1-888-454-8464. Or you can contact us through our website at healthyinformation.com. I'm Dr. Whiting, and thanks for listening.